We are working today with bonding a halo veneer onto an existing crown. The question is, number one, why the hell would you ever do that, right? It's not common, but when we have these beautiful, beautiful natural teeth here that we're trying to match, in addition, she has a narrow buccal corridor, much more narrow on this side than she does on this side. Crowns on both of the pre's on both sides. So what are we gonna do with this when she has two pre's that are tipped in and two pre's that aren't? We could probably just take the crowns off. Like, that would not be the end of the world. But what we don't see is that underneath these crowns are tenuous buildups. I don't know how you feel about cutting crowns off, buildups that are not super, super stable, but that could become a really big project. What we don't wanna do is disturb a stable situation. So what we've elected to do in this situation is we're gonna bond directly to the porcelain. Now, first, we've gotta make sure that all of the glaze gets taken off the porcelain. We will do that with a black striped diamond burr, very coarse. Then we're gonna follow that up with air abrasion with 20 micron particles for at least 30 seconds out of a high-speed air abrasion handpiece. Once we've air abraded the porcelain, we're going to then etch with 9.5% phosphoric acid for about 30 to 35 seconds until we see a beautiful frosty appearance. Then, very, very important, got to selenate that. Once that's selenited, we can add our bond and cure our bond. That's where we are at this step now, and we're beginning to add the composite directly on top of the porcelain crown. This is to correct her buccal corridor, make it match better without doing any removal of crowns that we feel like might be problematic. We're using our Mylar strip as a guide to make sure that the class 5 area of this tooth is covered, because the margin is actually going to be covered by composite. We're going to use a little bit of hydrostatic pressure to push that composite approximately just enough to make sure we have a good seal. Spatula is by LM Instruments out of Switzerland. I follow it with this LM instrument to kind of give this a little bit of a wall here. We're trying to bring the buccal corridor out, so we want this proximal wall to be a little bit higher, and oftentimes I will follow up with the brush. I'm going to remove our Mylar now. Look what we have. This beautiful little, like a class 1. It's ours to fill with what we want, but we know that the sides are sealed. So because this is a little rough in here, I like to add a little bit of flowable composite and just brush it in to make sure that I'm getting a good connection. And then I'm going to just add body. We made it a little bigger than its other side, which is perfect because that's going to allow us to kind of tidy things up to the right size. So I'm going to use a disc to reinforce that first plane, and then everything behind that central ridge from this view should disappear, leaving just the central ridge. If you want it to be very angular, you can leave it angular, but most of the time, we're gonna wanna just gently soften that. Okay, so final product, here we are. We've got a super good gloss. The buccal corridor is wide on both sides. Most importantly, everything just kind of flows in our arch form both sides.